Upgrade your practice with Genomind. Smarter mental health prescribing guidance that's good for life. The traditional process of treatment by trial and error has contributed to higher healthcare costs and the pain of unsuccessful outcomes. Only about 50% of patients with depression and anxiety will respond to first-line therapies. Your patient's mental health and how they may react to medication is influenced by a complex interaction of factors, such as lifestyle, environment, and experiences. However, we've been missing an important piece of the puzzle when it comes to mental health drug response: your patient's genetics. Now, with Genomind Professional PGx Express, you can access this missing piece for a more complete approach to mental health and wellness. That's the new Genomind Mental Health 360 approach. In a naturalistic study using Genomind's PGx services, 87% of patients demonstrated clinically measurable improvement. And in a major case control study, use of Genomind's PGx services were associated with 58% fewer hospitalizations, 40% fewer emergency room visits, and approximately a $2,000 reduction in individual healthcare costs over 6 months. Pharmacogenetics, or PGx, is a field of study combining the science of pharmacology and genomics to explore how an individual's genetics may influence their response to drugs. The FDA has stated that pharmacogenetics can play an important role in identifying responders and non-responders to medications, avoiding adverse events, and optimizing drug dose. And Genomind Professional PGx Express is more than just a test. It is the most advanced and comprehensive mental health PGx service available. Our service includes 24 genes related to mental health treatment, including genes and drugs for conditions like ADHD and others to support your pediatric patients. Over 130 medications. Coverage for more than 10 conditions. State-of-the-art precision medication management software. Expert PharmD and PhD consultations. And our e-concierge platform giving you lifetime access to superior service, educational support, more convenience, and faster results. Now, let's take a closer look at all of that. Unlike other mental health PGx services, Genomind provides a more comprehensive report divided into 6 detailed sections for ease of use and comprehension. This is a sample report. The first section provides the patient's genetic results for 15 pharmacodynamic genes, as well as the therapeutic implications of the patient's genotype. Let's zoom in on MC4R. In this example, the patient's genotype has an alert indicating a higher risk of weight gain with second-generation antipsychotics. The second section covers 9 pharmacogenetic genes associated with drug absorption and metabolism. These can help you create personalized dosing regimens. For example, drug exposure may be increased or decreased depending on the individual's genotype. At Genomind, we are committed to providing you with the best tools and services in the industry. In addition to getting this information on the report, your patient's pharmacokinetic results also automatically sync with GDIG, our state-of-the-art precision medication management software. Other tools typically look at only gene-drug or drug-drug interactions. Knowing only your patient's genotype may miss 20 to 30% of potentially serious pharmacokinetic drug-drug interactions. GDIG covers 95% of the most commonly prescribed medications, including non-psychiatric drugs. It can even account for lifestyle factors like coffee consumption and smoking, which may affect the metabolism of certain drugs. Now you can get a more complete picture of your patient. Moving to the third section, here we report on 130 drugs that are approved for a psychiatric or neurological indication and how the patient's genetics affect each drug. Drugs are organized by therapeutic indication and class: antidepressants, mood stabilizers, antipsychotics, and so on. For a given drug, the genetic impact of the patient's genotype is displayed using intuitive icons. The fourth section provides a more visual representation of drugs indicated for the most common diagnoses, including depression, anxiety, ADHD, bipolar disorder, and pain management. Drugs are shifted to the left or right depending on genetic factors associated with efficacy, tolerability, metabolism, and absorption. The extent to which the drug is shifted reflects the cumulative pharmacogenetic factors impacting the drug. The fifth section is an overview of our test methodology and literature references. And the sixth and final section consists of Genomind's RX Metatype card. This card allows your patient to share their individual genotype with other providers outside of mental health. In addition to our advanced report, we want you to know that we are your collaborative partner. We will provide clinical support every step of the way. As a provider, you will have access to our on-demand hotline and scheduled consultation services with our PhD and PharmD experts to help with anything from in-depth report interpretation to answering one-off questions. Finally, we provide our superior lifetime service package. Our e-concierge platform includes express overnight shipping to and from the destination, whether you ship directly to your patient's home or to your office. Complimentary pickup from your office or your patient's home. Unbeatable lab accuracy. Every sample is tested twice for a 99.9% accuracy in our CLIA, CAP, and New York certified laboratory. Results delivered in 3 business days or less, the fastest in the industry. You also get exclusive access to our comprehensive digital education program and support system. All of this is easily accessible in our clinician portal. As your partner, we worked hard to streamline the process so that everything from ordering and returning the test to getting the critical information and consultative services you need is effortless. We even handle all patient billing. Your patients deserve the highest quality of care. 95% of Genomind clinicians surveyed said our service helped them make safer, more informed treatment decisions. Our online registration to access the clinician portal is fast and easy, and there are no commitments. Simply go to genomind.com/register to get started. Get access to smarter prescribing guidance that's good for life. Are you ready to upgrade your practice? Genomind, leading the evolution of mental health care.